Record home.
So we are good to go.
Okay. Welcome all members of American College of Physicians India chapter as well as other chapters, those who are listening us. Greetings from India, and today we are going to discuss a very important topic. As you know, in this part of the world, we are going to have a season of fasting. This fasting season is going to start from tomorrow in India, and I think in other parts of the Asia, it may be maybe 2 days after. But very important thing for the rarely we get both the festivals are coming together. But the very important thing is that when a doctor is looking over to the people who are going to fast or who are planning to fast from their point of view of health, then a lot of things comes in the mind. And the first thing comes in the mind, what is the logic behind the fast? Is it only religious? Is it only faith? Or any science is also behind this tradition or this practice what majority of the people are doing? To discuss all these things, we have planned a very good panel with us. Our speaker today will be Dr. Krishna Sheshadri. Dr. Krishna Sheshadri is a well-known endocrinologist. He is on the American Board of the Certified Endocrinology, Diabetes, Metabolism and Internal Medicine. He is a well-known clinician, especially the endocrine clinician of the Chennai, clinical and research lead in Apollo Sugar and senior consultant Apollo Hospitals, professor in endocrinology and medical education and board member Shri Balaji Vidyapeeth and MGM Health. He is recipient of the multiple orations, including the P. N. Shah oration of the Endocrine Society, Sam G. P. Moses oration of the RSSTI, Sindhu Pandit oration of the Dr. A. Krishna Rao Memorial oration in medical education. Former Honorary Secretary of the Endocrine Society of India. He has also been Founder Secretary and past President of the Endocrine Society, Tamil Nadu. And he has been editor and presently Associate Editor of the Journal of Diabetes in Developing Countries. He is Editor-in-Chief of the Thyroid Research in Practices and International Journal of Clinical Metabolism and Diabetes, which has been recently started by the RSSTI. Editorial Board Member of the Indian Journal of Endocrinology and Metabolism. He is member of the Curriculum Expert Group of the National Medical Council and Director of the Primer, which is an Academy for Medical Science and Clinician Education. So with this brief introduction of Dr. Krishnaji Sheshadri, I must introduce our eminent panelists also, those who will be giving answer and giving their opinion about the topic. Dr. AKM Aminul Haq is joining with us from Bangladesh. He is an eminent physician of the Bangladesh. He is professor of medicine at Anwar Khan Modern Medical College at Dhaka. He has been passed out from the Dhaka University, having multiple publications, having a teaching experience of the both undergraduate and postgraduate teaching, has been guide to many postgraduates and intern doctors. He has been involved in the training of the medical officers in Bangladesh and office bearers of the Bangladesh Society of the Medicine as well as ACP Bangladesh. Dr. Narsingh Verma, I think most of the people of ACP as well as in India knows him very well. He is the person who has started the concept of the chronomedicine in India and started talking about the circadian rhythm when nobody was talking about this. And that's why we asked him today, because change of the circadian pattern is involved in today's fasting nowadays. So that's why Dr. Narsingh Verma would be keeping his opinion on that. And apart from that, he is a teacher of the physiology. He is professor and head in King George Medical University in Department of Physiology as well as Department of Family Medicine. So a vast experience he is carrying with him, and we shall be benefited today with his vast experience and from different point of view to see the issue which we are going to discuss. Dr. Kamlakar Tripathi is again a very prominent personality of the country. He has been the professor in BHU, Banaras Hindu University. He has been the professor and head in BHU, as well as eminent nephrologist, and we shall be getting a nephrologist point of view also from the fasting. So we are having endocrinologists with us, we are having nephrologists with us, we are having physicians with us, as well as we are having a physiology expert with us. And apart from that, Dr. Arun Kedia has also joined, and he is having very good knowledge about the nutritional sciences. So we shall be having a very good panel today for this discussion. But before we start our discussion, I will request Dr. Krishnaji Sheshari to give a presentation so that which can be stimulating our discussion. Over to Dr. Krishna.
Thank you. Can you allow me to share my screen? It is
yes,
not...
sir.
Yes.
RX event, please allow Dr. Krishna to share his screen.
So you can share now.
Yeah.
Can you hear me now? Anuj, can you hear me? Anyone can
Yes,
you
sir.
hear
Yes, sir. You're audible.
me? Okay.
Yes, sir, you are very much audible. I am here.
Okay. Thank you very much. Thanks, Anuj, and thanks everyone at the ACP for this great opportunity. I'm just going to sort of, give a broad overview and leave a lot of things unsaid, and hopefully that comes out in the discussion. I have no conflicts of interest. This is something that we need to start thinking about. Fasting was religious for many, many centuries. Now fasting has become a fad. It has become part of lifestyle. It has become part of something that people talk about. And there are several parts of this that we need to understand, because in the literature you find several words used. One is a time-restricted eating, which is a daily short-term fast for about 12 to 23 hours, depending on the window in which you eat. Then there is something called alternate day fasting, where there is one ad libitum feed with a day of no calorie consumption. Then there are modified alternate day fasting. Then, of course, there is periodic fasting. It's complete fasting for 1 to 2 days per week, and then the rest of the day, it's a week, it's fine. And then variations of tofa. Now, most of us, when we think about religious fasting, we think about Ramadan. It has captivated our imaginations. It is available. It is there every year, and importantly, a lot of data is available on Ramadan fasting. But if you live in India, there are other communities and other kinds of fasting. For example, there is modified fasting that the Christians undergo during Lent, and the Jewish community undergoes. The most severe of fastings you will find in the Jain community, which can even go up to 40 days with very little, including water. The Hindu fasting is very interesting because the most important of these is just twice a month, called the Ekadashi Vrata, which is and it's probably the most that is followed in the country. But then there are others. For example, this time is the Vasanta Navratri. There are 2 Navratris a year, Vasanta Navratri and the Sharan Navratri. The Navratris are 9 days. The Muslim calendar allows people to have a short meal at sunset, and then of course they have another meal, a larger meal, before they go into a fast. And the duration of the fast varies simply because of the latitude. The Indian fasting, if you were to follow, there are varied gradations of the fasting. The most ideal that is prescribed for example, the Ekadashi fast is the previous night before sunset, you have your last meal, and then you go on until the next day morning, which is 36 hours, at which you break the fast, which is called the Dwadashi Parana. And that means and this could be Nirjala, which means no water, or Sajala, which can be just water. It could be, and depending on the age, depending on the customs, it could be Falahara, which means that eating fruit, or it could be small, but irrespective, it's all hypocaloric. The Navratri fasts are also the same. Many people do it taking nothing till evening and then this thing. Just to sort of tell you is the circadian bit into it, and I'll talk about it a little more, is that most of these fasts, the Indian fasts, the food is consumed before sunset. The last meal is consumed before sunset. Even the fast, if it is broken, it is consumed before sunset. Of course, nowadays things have changed. People are eating the way they want and others, but the traditional Indian fast would be before sunset. Okay, so what do we have data for? We have a lot of data that is now accumulating in intermittent fasting, which is the alternate day fasting, the periodic fasting, the time restricted eating, right? Very little since the 90s and the 70s for the long-term fasting, but a lot of data is also emerging for caloric restricted mimicking diets and modifications thereof. Why has fasting caught our imagination? This is the one slide that will tell you why it has caught our imagination. On the top left is bacteria, then there is yeast, then the worm C. elegans and mice, and each of these it has been shown that caloric restriction through intermittent fasting, reduction of calories have all resulted in these animals and living beings an increase in longevity. We notice in yeast almost a tripling, in bacteria almost a doubling, in C. elegans again a doubling, and in mice about at least 50% increase in the longevity. Seems to be that if you eat less calories, you actually live longer. This data has been elusive in humans, but it has nevertheless caught our imagination. We'll talk about it. To understand the physiology of fasting, it's important to understand how the fuel is kept. So this is the total body composition, and this is the total metabolic fuel, of which 113 calories circulate, 80 calories from glucose or 30 calories from triglycerides. Then this is the store, 300 calories from hepatic glycogen, 150 grams per muscle glycogen, 6 kilograms of protein, 15 kilograms in fat. Clearly, fat is a major storage, but each of the others are also important. I've talked about this in many fora. I just want you to remember that for most of us, there is an energy sleep cycle, that there is a partitioning of fuel. Glucose is available when light is available. If you're a light agent, I mean, if you follow the light cycle. And then there is a dark cycle in which fatty acids are present. These fatty acids form the fuel, but importantly, that's also a time of renewal, mitophagy and autophagy. When glucose is not available as a primary fuel, there is a breakdown or lipolysis. The body uses fat. At the same time, there's an activation of mitochondria that allows use of lipids, but importantly, to improve the efficiency of the body. And this is probably one of the reasons why we live longer, or at least other animals live longer if calories are restricted. And these are the circadian inputs in the metabolism. I'm not going to go into this today, but remember that the fed phase and the fasting phase are very clearly circadian determined. So what happens in fasting? The initial fast, remember, there's an increase in resting energy expenditure for a period of time that comes down. But what really happens is glucose is produced from both the glycerol, the amino acids, and fatty acids. And importantly, ketones are generated. The ketones are used in the myocardium, the renal cortex, the skeletal muscle. There's always a small emergency reserve of hepatic glycogen. The central nervous system predominantly uses glucose, but over a period of time, the fast is prolonged, it starts using ketones, and I'll show it to you. The neuroendocrine system adapts to the intermittent fasting. One, there is an increase in the network plasticity, increase in neurotropic factors, increase in mitochondrial biogenesis, there's a reduction in oxidative stress, but also production of this particular brain-derived neurotropic factor, which I will talk to you about in a moment, but others that are happening. But the most important, and I'll talk about it in a moment, is a decrease in insulin that is very key to this whole thing, and leptin, of course, changes. The heart acetylcholine changes, there's an increase in parasympathetic tone, reduction in heart rate, an increase in heart rate variability, reduced blood pressure and stress resistance. And this occurs every time you fast. And then there's an increase in energy uptake. There's a reduction in inflammation, part of it probably due to the change in microbiota, we'll talk about it. Then there's an increase in lipolysis, ketogenesis, a reduction in leptin, an increase in adiponectin, a reduction in inflammation. In the muscle, there's increased insulin sensitivity, enhanced anabolism, and increased stress resistance. That brings us to the two key hormones in the fast. One is insulin, or the lack of it allows many changes to occur. The second, and this seems to be the only known function of this, is the beta-3 adrenergic receptor, where noradrenaline activates G protein and then causes conversion of ATP to AMP, and then mobilization of free fatty acids through active hormone-sensitive lipase. That's really what drives the lipolysis and allows the fuel to build up. An example of leptin, and I'm just showing this is lean and obese people. At 14 hours, you will see that the free leptin is already down. And this is in the obese people. This is a little less in obese people. But you see what happens to lean people in 22 hours. There's almost a 60% change in the leptin. So clearly, leptin is driving some of the changes in the body. When you fast for a long period of time, and remember that neither the Ramadan nor the intermittent fastings are all prolonged periods of fasting. But if you do fast like the Jains do, then for a period of time, the free fatty acids break down. Luckily, the proteins don't break down after a period of time, but there's clearly ketones that become a very, very important part. The good news is that that's one of the reasons that people talk about there's no really muscle wasting in this kind of fasting, that the proteins are preserved. So the three phases of the fasting, one is the post-absorptive phase, in which the CNS does use glucose over a period of time. The gluconeogenic phase, with protein catabolism, takes place, and that is used to send glucose to the brain, while the other tissues feed on ketones and fat. But then there is a protein conservation phase where lipogenesis and ketogenesis takes place, and the brain also starts using ketones. This is just showing the same thing that I talked about, that initially in the fed state, glucose is the preferred substrate for the brain, but over a period of time, it starts using beta-hydroxybutyrates and acetoacetate. Just the extreme example of this is the penguins, where there is fat depletion, but not protein depletion. And this continues for months on end, where the male would probably not eat till the chick is actually grown up. These are the neuronal circuits involved. The most important one is the glutamate, and this results in production of the brain-derived neurotropic factor. And these are the ones that take care of the brain, but they also are important in maintaining cognitive function. So what really happens in intermittent fasting is that systemic effects are: one, there is decrease insulin glucose, there is increase in ketone bodies, there is a reduction in IGF-1, increase in growth hormone, increase in ghrelin, sirtuin remains a chain. But here what happens is there's an increase in BDNF, there's decrease in mTOR activity, there's greater autophagy, decreased neuroinflammation, increase in synaptic resistance, and cognitive dysfunction or improvement in cognitive function is one of the earliest benefits of fasting that we know of. So what happens at the molecular level in fasting? So we'll go through this. When you have dietary restriction, and remember both the intermittent fasting and caloric restriction are pretty much the same mechanism. Remember, glycogenolysis, gluconeogenesis, and ketogenesis takes place. There are extracellular nutrients that are available. The mTOR pathway is deactivated, right? SIRT1 is increased. There's an increase in PGC, FOXO2, NRF2, therefore decrease in inflammation. Because there's a reduction in mTOR pathway, there's an increase in cell survival, increase in stress resistance, increase in autophagy and mitophagy, increase antioxidative capacity and DNA repair. In the circulation, glucose remains constant for most of the time. Insulin is reduced, IGF-1 is reduced, therefore there is benefit in cancers. Gluconeogenic amino acids are reduced, triglycerides are reduced, leptin is reduced, CRP is reduced, HDL is reduced, and T3 is reduced. Ketone bodies are increased, free fatty acids are increased, LDL and VLDL are slightly altered. What is even more interesting is that the gut microbiome changes. This is sort of variable across different kinds of fasting. But the one thing that we know is that the short chain fatty acid producing Faecalibacterium is actually upregulated. And therefore, there's a reduction in inflammation that occurs because the gut microbiome also changes. So what happens in fasting in normal cells? There's a decrease in IGF-1, reduction in growth, FOXO is activated, therefore there's production. The decrease in glucose, a decrease in proto-oncogenes. Similarly, in tumor cells, you should expect that there's a decrease in growth and decrease in cell death. Weight loss is sufficient initially, but then it plateaus because the metabolism changes in the body, reduces its metabolic rate. So what are the benefits of intermittent fasting? One, of course, is what people talk about is weight. But I think with the brain, there seems to be some evidence in many studies of cognitive function. Asthma symptoms improve, ketogenesis, glycogen depletion. Then increase in insulin sensitivity, there's probably muscle growth. There's enhanced endurance if combined with inflammation, with exercise. Reduce inflammation and reduce risk of sarcopenia. There's reduced cardiovascular risk, reduced blood pressure, reduced heart rate, increased lipolysis, decreased fat loss, increased fat loss, decreased inflammation and altered microbiome. And on top of this, there's weight reduction, reduced inflammation, improved body composition, probably reduced cancer risk. But let me sort of tell you what are the differences between human and animal models of intermittent fasting. Similarities, we find reduced fasting insulin levels, increased insulin sensitivity. Despite a reduction in fat mass, lean mass is mediated. Improved in obesity-related metabolic parameters, right? Reduction in obesity, decrease in IGF-1. But weight loss is not always seen in humans. This is something that we need to remember. Cardiometabolic, you will find reduced heart rate, attenuated blood pressure response and stress. There's a change in LDL, increase in the LDL particle size. You don't know what is really happening in HDL and blood pressure. In the immune system, we know there's an increase in inflammasome activation, the decreased leptin and increased adiponectin, decreased IGF-1. But the pro-inflammatory cytokines are inconsistent in humans. The nervous system, we find that there's an improvement in cognitive function, but we really don't know what is happening in terms of BDNF in humans. So that brings us to the day-to-day thing. What are the very, very good documents that people should look at is the IDF document on personalized care in Ramadan. And these are the factors that are important. One is the length of the fasting hours, the season of fasting, the weather, the geographical changes, the kind of diabetes, the kind of medications, the proneness to hypoglycemia, presence of hypoglycemia unawareness, the age, I would add frailty instead of just age, gender, whether they're pregnant or not, what is the meal pattern, each of these are important. This tool helps you identify who are at high risk. So people at low risk can really go ahead and fast if that's what matters to them. We allow them to fast, but that doesn't mean we withdraw the support. In a supportive manner, they can go through it. But we try to convince people at low, intermediate and high risk that it's not a great idea. But what this risk score looks at is the diabetes, presence of hypoglycemia, the level of complications, stability, the presence of renal complications, whether pregnant or not, frailty, kind of treatment, whether they are mixed boluses or not, whether they're taking sulfonylureas, whether they're monitoring the glucoses, whether they've had complications, and the duration of the fast. Those with high risk really shouldn't be going for it. But even if they do, we should still support them. Those intermediate, again, should not be doing it. And if they are doing it, we should tell them that, look, these are the things that you should watch out for, and the slightest hint to stop the fast. But those with low risk can actually undergo this, again, with medical supervision. So what I'm going, but let me summarize this with two shlokas from the Gita. Who should undergo fasting? One, I don't think there's a need for excessiveness. Intermittent is helpful. We don't have data whether it improves longevity, but seems to be there are much benefits. They all work through caloric restriction, not necessarily time restriction, but caloric restriction. But this is what the Gita says. Natyasnatastu yogasti na chaikantan manasnata na chati swapna shilasya jagrato naivacharjunaha yuktahara viharaya yukcha cheshtasya karmasu yukta swapna bhavodasya yogi bhavati dukkha. The path of yoga is not achieved by extremes. It is achieved by moderation. It is achieved by eating limited, by having satiety, but not doing the extremes that are required. Whether it is sleep, whether it is food, whether it is anything else. This is what the Lord in the Bhagavad Gita says. Follow a path that is of moderation. I think for our patients who are contemplating fast, a path of moderation is certainly something that we can recommend. Not to take them away from their religion, their practices and their values, but a guided approach to what is required. We do now have data to show that that path has benefits, but it needs to be, the right person needs to be chosen for the right kind of activity. With this, let me stop here. We have a great panel. I'm happy to join them for a few minutes and listen to them. Thank you so much.
Thank you, Dr. Krishna, for a fantastic talk, and it was really up to my expectation. I really wanted to call you on ACP forum for a long time. Today I got this opportunity, and I'm really feeling very happy on this decision. Before we go for the discussion, our two chairpersons are Dr. Kamlaka Tripathi and Dr. Aminul Haq are there. First, we shall take their comments. So, in the meantime, Dr. Kamlaka Tripathi, are you there? So,
Yes.
would like to have your comments on the presentation of Dr. Krishna.
Wonderful, wonderful evening and wonderful time with Dr. Krishna. As his name is, he suffices the same. He speaks like Lord Krishna in quoting the Bhagavad Gita shloks. It's true, we have talked and we know more better about the physiology of fasting. We know the animals who go under hibernation, 3-month, 4-month hibernation, and they develop a system of the glucose homeostasis. We also know what are the changes which happens during physiology that has been exhaustively studied. One comment I want to add, the GLP, that is what was left by Dr. Krishna. GLP is one also which gets stimulated. You fast, physiological fasting, and the GLP improves, and this helps in improving the insulin resistance and making it available. But what we are talking, and we are equally concerned about, the prescription of fasting in the patient who are suffering with type 2 diabetes. That's number one question. Number two, how to modify the fasting a patient who is a diabetic in these two situations. One is Ramadan, of course, which is a month prolonged, and then 9 days, which happen to be in Navaratri. Is the point of concern equally that the total quantity of food being consumed during fasting, and when you do fasting, what called nirjala, without a drop of water, as it is being observed in Ramadan and also in Nirjala Ekadashi, then there are certain situations in which it needs little attention, like volume depletion in patient of chronic kidney disease, in patient who are on the SGLT2 drugs, inhibitors. It requires a close watch on these patients. Some of the patient might deteriorate. So these are the two different aspects. Giving a prescription of fasting, one aspect, then doing research on the fasting and looking at the various metabolic parameters when we are talking in relation with the different disease condition. And third, looking at the religious factor in which they needs to be accommodated. So this is what I think. Water, without water, Nirjala Ekadashi for a renal compromised patient, type 2 diabetes on SGLT2 inhibitors, we require to look at the prescription, we require to look at the hydration, we require to look at the load, we require to look at the EGFR. But otherwise also, patients who are on the Ramadan and doing intermittent fasting, it is very well studied, and we know what the drugs to be used, the short-acting sulfonylureas, the timing of the dose, and the insulin therapy. So these are my comments. Yes, Dr. Maheshwari.
Dr. Aminul Haq would like to have your comments on this topic.
So you have to unmute, sir. You're not muted. You're muted.
Thank you. Can I hear? Thank you.
Yes, you are audible, please.
For elaboration of the fasting, I think he explained all ins and out of the fasting. In case of Ramadan, it is a religious ritual, and though long time fasting, almost 1 month, and in every day, almost 12 to 16 hours. So there are a lot of changes in the body, and there are some restrictions. If the person is very frail, if the children or acute or chronic patients and pregnant women or breastfeeding, these persons are exempted from the Ramadan. Only those who are adult and are healthy, they are supposed to do the fasting. And during this fasting, there are a lot of changes which are explained by the speaker. But there are some also changes in the Ramadan. Say, for example, Iftar and Suhur. During this period, usually the fasting persons are asked to take their food adequately and to drink frequently, so that during the fasting, he may not be dehydrated and he can enjoy the fasting. If obese and overweight persons do fast for the period, they lose some weight. That is also helpful for the persons who are doing fast. And in case of adult patients, because they have taken pre-dawn meal adequately, they can cover 6 to 8 hours by carbohydrate, and then the body fat can help to give them energy, which is the cause of loss of fat or body weight, and ultimately they do not need a breakdown of protein. So they may lose some weight, which can be regained after Ramadan, and I think there is no problem in health if they fast for the long time. Thank you.
Thank you, Dr. Aminul Haq. We shall be coming back to you again with some questions. But before moving ahead, my one question to Dr. Krishna. Dr. Krishna, since last 20, 30 years, 30 years, we are in the medical practice, and we have been grown up with the idea that if there is some patient, we should not allow him to go fast. We should not ask him to go fast. And we take a special session before the holy month of the Ramadan, that how can you protect yourself in the fasting time, and better you don't do fasting if you are not well controlled. And even if you are controlled, then you may go into the hypoglycemia and probably you may be having difficulty. But your lecture was giving us very different kind of the insight that this can increase the age. Fasting can reduce the cancer also. It can also reduce the growth of the cancer cell, and a lot of good things you have told to us. Then would you like to have your comment? What should be the scientific approach now?
So I think the first thing is that, while fasting is helpful and useful in the long run, it can also harm people who are vulnerable and frail and get hurt. So one of the things that I recommend a lot is this idea of risk stratification score. It can be used for any fasting, I think. What it does is it separates out the people who are at high risk. So those who are, it is like bringing the glucose down in somebody who already has coronary artery disease, like the ACCORD trial. You don't want to bring down the glucose very low in somebody who's already got coronary artery disease. There it is going to hurt them. So if someone who's got comorbidities, who's got renal dysfunction, who's prone to hypoglycemia, you still really want to tell them, look, I really don't think you should be going for it. But then there are a lot of people who are early in diabetes, who are stable on control, who are taking medications that do not cause hypoglycemia, who can benefit, who I don't see any reason for us to hold them back. We offer service, we help, we provide them the support, and go ahead and say, look, I'm okay with it. As long as you know the red flags, go for it. We are there for you. So I think, that subtle change in someone who's not at, so the way I'm going to put this is, those who are not at risk of immediate harm can actually go through it. Anuj, you're muted.
Sorry. So this is definitely a modification in our insight, that earlier we all were trained that if somebody is having some disease, try to convince him not to go on the fasting. But definitely, if we can get the benefit of fasting, then in controlled manner, we should try to help him so that he can get the benefits of the fasting, maybe religiously as well as scientifically and health-wise also. One question to Dr. Narsingh Verma. For a long time, you are listening this program, and I was willing to ask you. You are a person who has initiated the Society of the Chronomedicine, and you are the person who has preached many of us the chronomedicine, including me. As you know it very well, and you have said also multiple times, that nature has made us to keep on fasting for 12 to 14 hours. In the earlier days, when we were having the habit of eating after the sunrise and before the sunset only, then probably we were bound to have the fasting of 12 to 14 hours. Because from 6 p.m. to next 6 a.m. and then 2 hours or 3 hours would take more to prepare the breakfast and all that. So at least it's 14 hours and 15 hours fasting was usually occurring at that time. Now in the world, when it is 24/7 hours, we are working throughout the round the clock. Then does it make scientific sense that we should prefer this kind of the fasting, or we should keep this kind of the fasting in our day-to-day life apart from the religious aspect?
Thank you, Professor Maheshwari, for organizing this meeting, and especially on the ACP banner. And I will like to congratulate Dr. Krishna for giving very excellent lecture. I think almost everything he has included, and very scientifically he proved that what we were talking is not just a something related to religion, it is a science. And regarding 24/7, I still differ. Nobody can work 24/7. Few of us are working at night, few of us are working during daytime. So what is 24/7? But a person is not 24/7. Number one. Number two, our circadian rhythm has been primarily designed by basically one coup, that is the diet and sleep. Then secondary coup is the nutrition, environment, physical activity, and so on. So the secondary one is also important. Primarily, I agree that everybody has got a particular type of circadian rhythm. But secondarily, it can be affected by the secondary cues, and these cues are basically the physical activity and nutrition. And agreed scientifically that our physical activity, our physical endurance, our physical performance is better when we are in fasting condition rather than we are in prandial condition. So keeping all this in mind, I still say it is very, very scientific to have the at least 8 to 12 hour fasting during night time, even for those who are working during night time. Working during night time does not mean that keep on munching throughout the night. And liver requires at least 12-hour fasting. And in that 12 hours, liver will replenish all the enzymes, all the metabolic reagents which are required to carry on metabolism. If it does not allow liver to take rest during night time, then definitely liver will burden 24 hours. So for working in the sake of 24/7 world, you are making liver to work 24/7. That is not correct. You can work, the society can work, but at least liver requires this 12-hour fasting during night time. So scientifically agree that even today's world, it is very much possible and scientific to have the dinner at the early times and at least give 12 hours fasting to liver.
So thank you, Dr. Verma. So in a nutshell, we can take the message to survive in the 24/7 world. It's not necessary to eat or continue eating 24/7. We should do the fasting a sizable amount of the time. Then only we shall be able to perform well in this 24/7 world. So now coming to Dr. Meenal Mohit, the only lady today's panel. And very important question, not only from the Indian perspective, but whole of the world. Why do women keep fasting more? Is it gender discrimination or something else?
First of all, very good evening to all of you. And sir, Dr. Anuj Maheshwari sir, many congratulations for organizing this very to the point webinar on the very evening of Navratri and Ramadan. So that was appropriately to the point. Now, taking the bull by the horns, why women and fast? Dr. Krishna, it was a pleasure hearing you, as always. So, sir, not only the gender bias has been there since ages, I would say, it is more of a spirituality. See, fasting is not, we doctors find some scientific explanation for everything. But when our ancestors actually started fasting, it was more for the spiritual reasons, for the religious reasons. They were more for the wishing, that was just a way of probably calling the holy spirits and wishing good for men who were moving out for wars, maybe. So the women were left back at homes and at the forts to sit and pray for the success of their men. So probably we have inherited from there that, yes, the tradition has continued. Now coming to the modern era, fasting, not only, of course, it has its scientific basis, but we also find a way of detoxing maybe. We also find a way of connecting to the spiritual powers maybe. And it is a way of abstinence. It's a way of self-discipline. It's a way of many more things. So yes, I agree. Women are more into meditation, more into fasting, more into spiritualities, more into self-discipline, calming. The aura of the house is basically carried by the women. So rituals and all festivals, the entire burden lies with the women. But it is not so that the men are not fasting. Men are also fasting. Especially if we talk of Ramadan, it is both the genders are observing fasts equally. Navratri, almost all are fasting equally. Yes, there are few fasts where specifically the Nirjala or the dry fasts that are more observed by women. They can be tradition, we are bound by our traditions maybe, so we are following it. But yes, we do have a percentage bias towards women for fasting.
Do you find some scientific reason that why women do fast more?
Yes, if I say, then it will be a very long discussion and Dr. Krishna is here to support me. If I go by hormones, there is a huge difference between the build of a woman and the build of a man. The hormonal cycle that a woman goes through is a monthly cycle, whereas the hormonal fluctuations that a man goes is a diurnal cycle. So the subacute fat, the probability of getting converted into ketosis is more with women because of the subacute fat again. The role played by estrogen and the effect of fasting on estrogen is very different from the effect of fasting on progesterones. And the effect of fasting on testosterone is again very, very different. So women have, by the cycles of the moon also, by the cycles of their hormones also, and because of the more of the subacute fat, the women is more scientifically benefited by the right fasting in the right timings.
Yes, very good. Actually, I wanted to listen that scientific part only. And Dr. Verma, we were discussing this thing yesterday with Dr. Verma,
Yeah.
and Dr. Verma has also given the similar kind of the thoughts. So, Dr. Verma, would you like to add anything to what Minal has already told?
I 100% agree to Dr. Mohit. Only one thing I like to add: the physiologically, women are more tolerant to fasting, and they can tolerate fasting better, and they will be benefited by fasting more scientifically, as he has said, because of the definite different the endocrine value. What I will like to say.
So I think for a long time, Dr. Tripathi is silent. Would ask him one question before I again go to Dr. Aminul Haq. Dr. Tripathi, there is a question for you. In India, we perform multiple kinds of the fast. There are some are the fast, some are the restricted eating, and we in our own language we differentiate it between vrat and upavas. And in upavas we don't take anything like fasting like we do in Ramadan. In Nirjala Upavas, we don't take even water. And in Vrat, usually we leave any part of the meal, like we are not going to take the grain, we are not going to take the some solid food today, or we are not going to take the milk, or either we are going to survive only on the dairy products today, or either we are going to survive only on the fruits. So how much helpful is this kind of the fast? I would like to have your opinion.
See, we have not rationalized it. When it comes to the health, when you are not sick person, as Dr. Seshadri has given a lot of evidence-based information for the people where a lot of physiological studies have been conducted. And if within the health milieu, they do all better. In a sick person, as the Minal was also talking, Dr. Narsingh Verma was also talking, while giving a prescription for fasting, we must keep in mind, number one, hydration. You must drink enough water. In all Hindu mythology fasting, most of them are sajala. You don't, only Nirjala Ekashi, that comes only once in a year, not every time. Maybe once in a fortnight, but otherwise it is with the water. So hydration is a must, which very well compensates for the short-term intermittent fasting. Is a very good compensatory mechanism. Number one. Number two, don't eat during the night. So your liver gets rest, you get good time for the gluconeogenesis. That's the second. Number three, when you crave a little longer, then you secrete more GLP. So the requirement of anti-glycemic drugs also get reduced. That's number three. So what I would suggest as a part of prescription to a sick person, that he must take enough water. He shouldn't try, if person is a sick, if has got a sarcopenia, he has got a volume depletion, has got a compromised renal function, has got a liver disease with diabetes, I would suggest to have a good hydration and then to go for the rest of the meal, not meal at the night, give the liver rest. That's the one part I would like to add. And the second part I would like to add, avoid sulfonylurea. If he's taking, we should get short, quick-acting sulfonylurea, not the long-acting sulfonylurea. Likewise, also I would like to go for short-acting insulin in these sick people to prevent any catastrophe. That's what my suggestion.
Thank you, sir. Yeah, Dr. Krishna, I wanted to have your comment.
So I just wanted to add that when you look at these fasts, we need to sort of look at it, at least the Indian ones, you need to look at it from a bigger picture. So one is the seasonality of the fast and the availability of food. So for example, some of the things that we don't consider is the Chaturmasya. There in the Chaturmasya, which is the rainy season, there is removal of certain food grains, addition of certain food grains, removal of certain foods that are prescribed, right? Similarly, throughout the year, there is a seasonality that is. They knew a little more than we think that they did. I think that is the way I would put it. That there was a far more holistic approach in the approach of the fast, and we have not. And while trying to look at it, we in our clinical trial sense, we are cherry picking it. Probably the benefit is more holistic than we think it is. So there needs to be a lot to be explored in this particular thing. So it is not that something that our ancients did was stupid and what we now do today is wonderful. Nor it is the other way around. I think what we need to do is to relook at all of these, but also try to look at it from a larger perspective and see how this comes in. Again, the important thing is uh, if it's going to cause harm immediately, don't do it. But do you want to do it as part of a larger holistic program that will improve your health and there may be benefits, you should do it. I think that's the way we should look at it.
I
Yes,
think
thank you, Doctor. Yes, Dr. Meenal, you want to add something?
Dr. Sheshadri has pointed out very rightly. If we just observe the Hindu calendar, we will observe that both the Navratris actually fall at the time of whenever there's a season change. This change of grain production actually. And those 9 days of fasting was probably destined so that we could detox our body and can get accustomed to the new grain, new pattern of growth, new production. And so it really had some scientific basis to it, which probably we did not appreciate earlier, and probably we are doing it now. Another point is the fasts that we are observing, they are actually ending up in feastings. As Dr. Narsingh Verma is rightly saying, we need to detox our liver, or we need to allow our liver to get sorted out from the glycogen storage. But we really don't allow that, actually speaking, because by the time our fasting is over, we are already ready for another feast. So most of the fasts end in feasts. So that has to be checked when we are really recommending a fasting to either a healthy person or a diabetic person or any patient for that matter. So fasting within certain boundaries is accepted, but fasting when you are out of fasting, it should not be ending in feasting. So the calories which we have missed the whole day may not be doubled in the next meal.
So just to add to this, Anuj, I'm sorry to interrupt. Just to add to this, if you really want to look at this from another point of view, and just to bring in Dr. Singh Verma's perspective also, one that there was no. If you look at the traditions of the Indian food, there was no sanction for any food other than twice a day, because in those days you would not eat before you offered the food to a deity. There are only two mantras available. In the morning, it was called Satyam Vratena Parishinchami. In the evening, it is Ritam Varena Parishinchami. So there are only two mantras available. Only two mantras available to offer it to the gods. Once in the morning, once in the evening. So really, after the first food was sometime in the morning after your rituals. The second food was in the evening before the sun set, and that's it. So here we are eating all the time. So you're right.
So probably, sir, that's from where we picked up the concept of intermittent fasting, because we were almost not eating the next 16 hours.
Yes, actually sticking to the nature is the right thing to go with the healthful life. Dr. Aminul Haq, coming to you. In between you have been dropped. That's why I was not being able to reach you. But now there is a question for you. Dr. Meenal has very rightly said that most of the time whenever we associate the fast with the festivals or festivities, they end up in the overeating. And as in multiple fasts, maybe the Hindu fast or maybe the Ramadan, they are ending in the evening. So in the evening time, people eat more. And that overeating is there. And once it is a Nirjala fast or without water fast, then it is daytime, people are not even taking water, they are deprived of the water also. Then how do we justify this kind of the things scientifically, and how can it be beneficial for the health wise, and what adjustment we should make so that it could be more healthful.
Thank you. Actually, Muslims fast the whole day and they break the fasting by taking iftar. After iftar, during iftar, they will take only water or juice or dates. After taking this, they go for namaz, maghrib, and coming back, they take the food. But in some Muslim countries or in some rich families, they arrange more food to take. But even they take more food in the evening after Esha namaz, there are Taravi namaz that will take 20 rakats. That almost take 1.5 hours. If any person who is fasting and taking more meal and do prayer for this 1.5 hours, this is good exercise, and I think it will help absorption and digestion. So the person will not feel any troubles after overeating in the early morning. And if there is overeating in the late pre-dawn area time, that will cover the whole day fasting. Usually, they are instructed to take more food in the pre-dawn time so that in the fasting period, they do not feel any problem. And during this, initially, there is instant energy from glucose, then after gluconeogenesis, then after from fat. So the whole day almost spending by utilizing the glucose, gluconeogenesis and fat. So the person will not feel so much problem if he is healthy. So this ritual is helpful, I think, for health, even scientifically. Thank you.
Yeah, Dr. Aminul Haq, supplementary question is that who are those people whom you ask not to go for fasting?
There is exempt for the people, usually pre-adolescent children.
This is religious exempt, but medically or as a doctor,
Medically,
you
if
tell.
there is acute or chronic illness, and if there is pregnant women or breastfeeding, these persons are exempt from the fasting religiously, and also we scientifically advise them not to fast because there is provision during the after Ramadan they can do fast, which time they during the Ramadan they lost 2 or 3 days they can do this fasting after Ramadan. Even if he is ill, he cannot do fasting. He can feed poor people in exchange for fasting. This is also provision. So we scientifically we advise the persons who are frail and who are chronically ill disease, say for example diabetic, chronic renal kidney disease, and the adult person in case of female who are menstruating or pregnant or childbearing, though breastfeeding, we usually advise them not to fast.
Thank you. So now we are approaching towards the end of this program. We are just 1 minute short in completing our desired time, what has been allotted to us. And we had really very good discussion. Before I end the program and request Dr. Ajay Tiwari to give vote of thanks, would like that each and every panelist give a message, a very short and crisp message to our listeners, to the doctors, those who are listening this program, and those who are whosoever is attending this program, healthcare workers, doctors. What is your view about the fasting? And in coming months of the fasting, how should they behave and how should they go for? We start from Dr. Narsingh Verma.
Thank you. I think one line message from my side will be fasting is very scientific. So freely you can fast and have your religious activities. There's nothing bad in fasting, everything good in fasting. The only thing is that those who have some acute illness, I will not say chronic, acute illness, they must contact their doctor. After physician's advice, they can go fast. And if the physician is competent enough, he will not advise not to fast. He will adjust the drugs and advise to fast. Thank you.
Yes. Dr. Krishna.
So I would suggest that work with the patient's wishes and values. Make sure you're protecting them from harm. But if there is no risk of immediate harm, as long as they are able to work with you, be able to alert you and follow your instructions, I think you can guide them through the fasting very, very well.
Dr. Tripathi.
Yeah, thank you. Ensure good water drinking, maintain good hydration, select the short-acting drugs, those who are the sick people, and diabetic patient must keep a strict watch on the sugar level, at least if they're getting on the insulin, and then should act a short insulin. That's it.
Yes. I think this is trying to keep watch on the glycemic variability also, because in daytime there is a lowest level of the glucose, and in the high time, their night time, it is at the hyperglycemia and maybe the hyperglycemia, which is more than the routine days. So this kind of the glycemic variability is again very much harmful for the patient, those who are long time diabetic or long time having the cardiovascular adverse outcome. So this comes to my mind, and this thing should be avoided. So always to have that daytime fasting is good. Keep the drugs less, but at the end of the day, it should not be celebrated with overeating. Now over to Dr. Minal.
So I think fasting is a way to connect mind with body, soul, and spirit. So let us not ask anybody not to fast. Rather, be a support as a doctor and help them achieve their goals.
Dr. Aminul Haq.
I think all healthy adults should do fast. It is helpful and beneficial for their health. And even those who have morbidities, they can seek the advice of doctor before Ramadan, so that they can do the fast without any hazard. Thank you.
Thank you. 2-3 more experts are with us. If anybody wants to put his point, Dr. Amit, Dr. Anubha, if you want to make any point, you can.
So very nice deliberation and very scientifically talked about the fasting. I think it is very clear. We can all do whatever is there scientifically, as well as without affecting the religious beliefs of the patient. But right doing and following the doctors is a mainstay.
Amit.
Sir, I would just like to congratulate you and all the panelists here because of this wonderful program. And I'm sure those who attended this program, including me, they have benefited, and we will be better able to guide our patients. And also, if some other people, those non-medical people, if they were also listening to the program, they will also understand the things about the fasting in a better way. Congratulations, sir. Congratulations.
Thank you. Thank you. Now, this is a time to vote of thanks by Dr. Ajay Tiwari. Ajay, over to you.
Thank you, sir. And at the outset, I would like to thank and congratulate Professor Anuj Maheshwari, sir, and the Governor, American College of Physicians, for conceiving this great program on the art and science of fasting. This was a very apt time for this, because we are going to have a season of fasting in all the important religions of our country. So this was a very good time, and for moderating this session in a very nice way and eliciting the maximum out of our learned speakers. And I would also like to thank our chairpersons who have given us great insights as regards to fasting, bringing out all the aspects of fasting, be it the circadian rhythm, be it the religious factors, be it when not to fast, because that is also very important, when not to fast. So all these things have been brought out very nicely. And at the last, I will thank the learned audience for their enthusiastic participation, because without them, no program is successful. So thank you everyone for your participation.
Thank you everyone who took time to join this, not only to listen, but also to attend, also to give your ideas and viewpoints about the fasting. A special thanks to Dr. Aminul Haq, who joined from Bangladesh chapter, and also thanks to Bangladesh chapter, Bangladesh governor of the Bangladesh chapter. They deputed Dr. Aminul Haq to join our program. I am grateful. Please convey our regards and best wishes for the forthcoming Ramadan to your all chapter members, and at the same time, good wishes to all panelists, those who joined from India for their respective season of the fasting. Thank you very much. Good night.
Thank you, Anas. Thank you very much.
Thank you. Good night, sir.
Good night.
আমরা লিভ করবো না?
Thank you, sir. Good night.